A health plan you will not find on Covered California. Hello, I am Kevin Canals, an independent health insurance agent in California and a certified Covered California agent. But there is one health plan you will not find on Covered California that individuals and families can enroll into for 2026, and that is the Sutter Health Plan HMO. The trick is that you need to reside in the service area for the Sutter Health Plan HMO health plans. And if you believe you will never be receiving a subsidy through Covered California for whatever reason, and you like the medical groups, doctors, and Sutter facilities, and you want to keep those as your primary providers, then maybe looking at the Sutter health plans might be a good idea. So you do need to live in the service area for the Sutter HMO plans. So that includes, parts of Santa Cruz, San Mateo, San Francisco, parts of Santa Clara, the East Bay up through Solano, picks up Sonoma County. In the Central Valley, they are in Stanislaus, San Joaquin, Sacramento County, Yolo, parts of Placer, Sutter, Nevada, and El Dorado counties. So if you live in that region and it is zip code specific, then you can enroll into a Sutter Health Plan HMO. And all of the hospitals and medical groups affiliated with Sutter would be available to you where you reside. And you can see the list of hospitals down in the Bay Area: Alta Bates, Eden Medical, El Camino, Lucille Packard, Sequoia Hospital, Stanford Healthcare Tri-Valley Pleasanton, and that's just in the East Bay. It's not going to include Stanford over on the peninsula. And then you can see some of the other Sutter hospitals: the Valley Hospitals, Dameron and Stockton, Memorial and Modesto. We have St. Joseph's in Stockton, Sutter Auburn Faith, and of course the Sutter Medical Center in Sacramento, in Roseville, Solano, and Tracy. Then there are also the medical groups, where you can select a primary care physician and they will refer you to specialists within their particular medical group or within another medical group. Down in the Bay Area, we have Affinity, Brown and Tolan, Palo Alto Medical, and of course the Sutter medical groups over there. Over in the Valley, we have Sutter Gould, Sutter Independent Physicians, and Sutter Medical Group. So, and it's really important to realize that some of the health plans that are offered through Covered California or directly off exchange, they'll include some, but maybe not all of those Sutter hospitals, and they may include some of the physicians, but not all of them. A prime example is in Sacramento area. The Anthem Blue Cross EPO plan includes the Sutter Medical Foundation doctors, but not the Sutter Independent Physician Group. But if you're in a Sutter Health Plan HMO, you're going to have access to both of those. So are the rates competitive for the Sutter HMO plan? So I'm going to do a little rate comparison, and I'm going to focus on the Silver plan. In the Silver plan for 2026, it's going to have a $9,800 maximum out of pocket per individual, just like Covered California, because the plans that Sutter offers, Bronze, Silver, Gold, and Platinum, they are the standard benefit design plan. So they're going to be exactly the same type of plan, whether you go through Covered California or direct with Sutter. There's not going to be any surprises there. All the co-pays are going to be the same, and $50 to see a primary care physician, and all of the drug costs will be the same. But again, we do need to remember that in California, hospitals and medical groups are separate. And just because a hospital is in network if the doctor or the specialist you're seeing does not have admitting privileges to that Sutter hospital, you're not going to get the service at the Sutter hospital. And sometimes you'll have a Sutter physician, but you may not have access to a Sutter hospital. So when you have a Sutter HMO, they are both aligned. Kind of like Kaiser, Kaiser doctor, Kaiser hospitals, you can't go wrong. In the Sacramento region, looking at the hospitals and the various plans that are offered, you can see Sutter Medical Center is in the Anthem EPO and the Blue Shield PPO and the HealthNet PPO, but not necessarily all of the Sutter doctors. If we look at the rates, focusing on the Silver 70 off-exchange plans, I've put in various ages there in Sacramento County, Region 3, and I'll just go ahead and focus on age 40. We see, and I'm just using the Blue Shield HMO, which doesn't really have any Sutter doctors or hospitals involved. The full rate, no subsidy, $634. The Sutter HMO plan, exact same plan. Remember that, exactly the same plan. $706.76 per month. And then the most expensive plan would be the Blue Shield PPO at $962. So the Sutter HMO off exchange is right in there. It's competitive. Some of the other carriers may have lower rates like Kaiser or even the Anthem Blue Cross EPO. You need to compare that, but I'm illustrating that the Sutter HMO is not out of line. If we go down to San Francisco County, you can see the different Sutter affiliated hospitals in network with the Anthem EPO, the Blue Shield PPO, and Chinese Community Health Plan. One of the things that makes the Blue Shield PPO so expensive in many areas is that it has the UCSF system in network. So that can be very expensive because UCSF is an expensive provider. When we look at the rates for the Silver 70 off exchange for 2026, again, I'll focus on age 40. We see that Blue Shield HMO with very limited access to any Sutter doctors or hospitals, $688 per month for a 40-year-old. Sutter HMO comes in at $852. And then the Blue Shield PPO at $941.58. But again, the Blue Shield PPO also includes UCSF and the UC Davis. And with that PPO, you can go virtually anywhere in California and be in network, as you don't have to receive the services in that area. Going down to Santa Clara County, the Sutter hospitals affiliated, El Camino and Lucille Packard. Anthem has both of those. The Blue Shield HMO also includes El Camino and Lucille Packard, and the Blue Shield PPO does as well. But that Blue Shield HMO, I don't believe is going to have any of the physicians, or very few of them, in the Sutter Medical Group. So again, we see the hospital may be in network, but if your doctor or specialist is performing the procedure that wants to use that hospital, doesn't have admitting privileges, you're not going to be going to that hospital. And looking at the rates in Santa Clara County, this was a little bit surprising to me. We go down to age 40, the Blue Shield HMO, $837. The Blue Shield PPO comes in second at $1,055. And then the higher cost Sutter HMO is $1,166. It's very comparable, obviously, to the Blue Shield PPO. I was just kind of surprised that it was a little bit more expensive than that Blue Shield plan, which just goes to illustrate you've always got to compare the different rates. Now, the first filter are your doctors. Which health plan has your doctors in network? Then your hospitals and specialists. Then you start looking at the rates to see how what is going to be the best economical health plan for you. Now, the bronze plans are going to be a little bit less. The gold and the platinum, there are some unique scenarios, healthcare situations that people have where the extra cost of a gold and platinum is warranted to reduce the overall healthcare expenses. But a silver plan is very good and will work for most people, especially if you are taking any brand name prescription medications. But overall, the Sutter Health Plan HMO throughout the Bay Area and Sacramento is competitive if you're never receiving a subsidy through Covered California. So it's something to think about because 2026 looks to be kind of an odd year, and you don't have to have the entire family in a Sutter HMO plan. Maybe some of the family members are in a Sutter HMO Silver plan, and maybe some of the other members are in a Kaiser plan through Covered California or something. You know, you can mix and match. But if you do want the straight Sutter HMO health plan, it is only available off exchange direct with Sutter. Contact me, I can help you get enrolled into that. So if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Canals.